How has AAPM&R been supporting our members to lead the way to ensure our physician peers, health system leadership, and insurance administrators understand the role and value of PM&R?
Yeah, that's a great question. So, many years ago, when I first started serving on the Board of Governors, we embarked on a mission to really think about where we felt the field of physical medicine and rehabilitation needed to be going forward. We recognized that there were so many challenges in healthcare, and we wanted to position our field, PM&R, physiatrists, not so that we would just survive all of these healthcare changes, but really thrive, recognizing that if medicine is truly to achieve that triple aim of better population health, better patient experiences, and doing it more efficiently, then you need physical medicine and rehabilitation in order to achieve that mission, or at least to achieve that fully. That's when we started PM&R Bold. We brought literally thousands of physiatrists together across the country at various times, getting their input, and we came up with our bold mission, which is that physiatry and physiatrists are vital, essential, and indispensable in reaching that triple aim of medicine. And there are many other barriers that we need to deal with as well. There are barriers of, dealing with scope of practice infringements, insurance denials, making sure that we're reimbursed. But one of the things that we really want to be sure of is that physiatrists are also the local champions of what we do in their own environment. So the Academy has really done a lot to promote that. So it's not just the Academy leadership. We need everybody to promote our specialty so that everybody knows what we do. We need to promote that to the hospital C-suite, the health system C-suite, to government officials, to insurance administrators, to the general public. And to do that, we are providing opportunities for our members to get that training. We offer, you may be familiar with the Future Leaders Program. This identifies every other year a number of young leaders who have potential to be leaders, and we involve them in academy activities and leadership and what have you. We offer various in-person trainings, toolkits, lots of webinars that focusing on how you as a physiatrist can really promote PM&R and communicate that to the folks who need to know it, those key stakeholders that I mentioned before. We have leadership training sessions at the annual assembly, which this year is going to be in New Orleans, which is going to be fantastic. So make sure you go, with a really great event at the Superdome. So make sure you attend. We are currently developing medical directorship training programs, which we're expecting to have registration open later this year, which is going to be fantastic. There are a whole host of volunteer opportunities that any member can get involved in. This really gives you an opportunity to get involved in the Academy and be a leader and have more of an impact. We work together. The impact of us working together is greater than the sum of the parts. But some of these volunteer activities include our Advocacy Day on the Hill, which I participated in the past. In the past few years, some of that has been virtual because of the pandemic, but we're back on the Hill now, talking to members of Congress, really letting them know the value that we offer medicine. We're working on guidance statements right now for PASS, but we have more planned in the future. And there's so much more that we're doing to really address helping our members, physiatrists, really champion our field and letting the folks know who need to know what we do and the value we add to medicine. We're doing a great job with that, and I would encourage anybody to take advantage of all of those offerings or any one of those offerings I mentioned.
Great, thank you. Just from my experiences throughout the past year, being part of the Physiatrists in Training Council, I'm just very impressed by how much there is, how much AAPM&R offers its members in trying to promote the specialty, to promote members of PM&R. And it's been a privilege and honor to be a part of it this past year. Thank you, Dr. Flanagan.
Yeah, I mean, and I think it's important to recognize, and I think you do, Jason, is that the AAPM&R is an organization of physiatrists for physiatrists. And there are so many organizations, medical organizations you can belong to, particularly if you have a certain niche that you're involved in within medicine, and certainly PM&R is really quite diverse, but there's no other organization that is truly physiatrist driven for a physiatrist. I mean, there are and that has the influence that the AAPM&R has. So it's so important to be a member and to volunteer. So thanks for sharing that.